discussing simulation learning and training. This is our Engage Learning NUR 525 class. So my objectives for the day is to examine the role of the nurse educator in the simulation environment, explain why simulation technologies are pertinent in the nurse educator's role, and why interactive learning creates an amicable environment. And also, we're going to describe the importance of simulation practice prior to the actual clinical start date for the newly assigned registered nurse. So, as I did a self reflection, I wanted nurse educators to um, emphasize why simulation is important. So, some of the myths that some of the students have is that myth number one, simulation is not real. Therefore, I don't have to take the simulation environment seriously. Well, if that's the mindset that the student or the newly assigned nurse has before entering the lab, they probably won't take anything away from the simulation experience. So, our job as nurse educators is to change their perception of the simulation lab. And this is really crucial because next week we'll be going to the simulation lab and you're going to see more importantly what I'm talking about. Myth number two is simulation is a thing of the past. We need real patience for nurses. Well, it's not a thing of the past, and simulation has been around for decades, and it's a proven technique. See, simulation and the use is everything. As a pilot, I use simulation to um, learn advanced skills like emergency procedures and landing. They teach pilots how to fly 747s, even rescue missions. They have police simulation. So, simulation is not a thing of the past, it's for nurses today and it's relevant for our time. And then, myth number three, the mannequins that are used are old and outdated. And that's simply not true. We have low fidelity mannequins and high fidelity. The low fidelity mannequins are used to start IVs, central lines, and Foley catheterization. The high fidelities include Megacode, ACLS, Birth and Mom, and we actually were involved in resident training with Ebola training. So the role of the nurse educator in the simulation lab, the low fidelity, like I said, it's you can have a case scenario where you educate the student concerning the patient. For example, you can place an arm with an IV so they can start a venipuncture. And also we have mannequins in the skills lab for NG tube insertion. We also have high fidelity that's in the Star Center where the mannequin it replicates a real live patient. So students may listen to various body sounds like heart rhythms and even groans as far as pain if a mother is giving birth. And then we use the high fidelity training with Baptist for our Ebola training. So, whenever the nurse educators are in the sim lab with the student, what we're assessing are their cognitive, affective, and the psychomotor skills. Now, there are advantages and disadvantages with both. Okay, but so some of the advantages, it's going to always provide a positive atmosphere that is conducive to learning. Whenever a student feels like this atmosphere is non threatening, then they can learn more and advantageous. It guarantees experience for every student and it allows independent critical thinking, decisions making, and delegation. One thing I like about the simulation is that, um, there's roles that will be assigned for each student, whether they're the charge nurse, respiratory therapist, or maybe the medical doctor. Each student is assigned a different role, and then they will grow from their experiential learning. The great part about simulation is the debriefing components. Everything is recorded, and we ensure that students know that they're being recorded, because once we debrief the students, they can actually view the recording and pick up on things on which they can improve on. Now, the simulation environment, it can be very emotional. It's an experience, and communication plays a major role. You need to have a higher order of thinking in the simulation, because we want to see that you can demonstrate critical thinking. We're going to accentuate the positive and make sure we use our time wisely, and it is structured. So some of the advantages that I've already spoken of is student-centered learning. It's a guaranteed experience from every student as long as they have a positive mindset of the simulation scenario. It allows independent critical thinking and decision making and delegation. And it provides a firm foundation for experimental learning. And I already talked about the debriefing. So one thing about the simulation lab, it gives the students an opportunity to make a mistake and learn immediately from these mistakes. As nurse educators, we can provide on the spot feedback. We can tell them, hey, what they did wrong. Do you think you might want to do it this way to change up something? And then role play plays a integral part of the learning experience. Now, certification for faculty and staff to train others. Right now, presently at Jacksonville University, there are no certified simulation lab instructors. We're looking into certifications, and hopefully that will be in the near future. Now, some of the disadvantages, students may not take simulation experiences seriously. We know that if the student mindset is like, well, these mannequins don't talk, this is not a real IV, they don't take it seriously. So as nurse educators, we have to um, make sure we instill in them to take this seriously. Some other disadvantages might be the lack of experienced personnel. Because no one is really certified, we have different faculty who's been trained and worked in the simulation environment for many, many years, but no one is really certified. So it's a lesson learned, and we're learning as we go. Now, the thing about the disadvantages that simulation, it attempts to portray a real situation, which is general or very complex and difficult. Although once a student nurse or actual nurse is in a clinical environment, they may run into situations that are outside of the simulation. So we're going to try to give them everything necessary to their advantage. So our role of a nurse educator in simulate. Some more disadvantages: students may not take it as seriously, lack of personnel, and I already talked about the other one. So the purpose of the simulation time for learning and experience, to reflect on the experience and make meaningful experience of the learning, corrections of the error, and then the role play that I've already discussed. Effective competency checks for undergraduates or new graduates through the orientation. So simulation training prior to the actual clinical setting has been approved by the NCSBN, the National Council of State Boards of Nursing. The results says that a high quality simulation experience can be substituted up to 50% of traditional clinical hours. Now that's very, very good. And that's very good for our training, because newly assigned graduate nurses can substitute the high fidelity simulation up to 50% of their clinical time.
Yes!
Now, these are the references that I have for this simulation PowerPoint presentation. There's plenty more to look at, but I hope you enjoyed this class, and I look forward to talking to you soon. So a few questions I have is, can a high fidelity simulation experience be counted as a real bedside clinical experience? What do you think? We already know that 50% can be substituted. And how do you determine if simulation experience has been effective for the nursing student or newly graduate registered nurse? At the very end, we debrief and ask for their opinion. They fill out a survey, and we'll take that survey to